edition of Video News. My name is Angie BEE, and I am honored to be your reporter for today. Today's special announcement comes from Springfield, Massachusetts. At 45 years of age, on May 1st, 2006, patient Judy Peters attended an appointment with Dr. Carlos Valdez at a major hospital in Springfield, Massachusetts. She went there in order to have a needle core biopsy procedure performed. Dr. Valdez told Ms. Peters that this type of procedure would take about 15 minutes. However, Ms. Peters remained on the procedure table for 1 hour and 35 minutes, during which Dr. Valdez said she hemorrhaged the entire time. Valdez admitted to administering epinephrine at least 5 times during the 1.5 hour time interval. A registered nurse was called over the hospital's intercom to come into the procedure room in order to take Ms. Peters' vitals. At 10:10 a.m., the nurse recorded that the patient's pulse dropped to 2 beats per minute, and at 10:20, it had gone up to 6 beats per minute, though a handwriting expert uncovered that those numbers had been tampered with. The patient's blood pressure was recorded to have dropped to 80/50. However, Ms. Peters heard the nurse say 60/50. The patient soon fell unconscious on the procedure table, and she was moved to a different room where she remained unconscious for 1 hour. She was not provided oxygen, IV fluids, or a blood transfusion. She was not taken to the emergency room, despite the fact that the ER was on the same floor as Dr. Valdez's office, nor was she taken to the intensive care unit. When she woke up from her unconscious state, Dr. Valdez instructed Ms. Peters to return home and drink orange juice, and she will be fine in 3 weeks. It took Ms. Peters 10 hours to drive herself home when it usually takes only 1 hour. She was forced to continually stop at various locations along the way to sleep, and she does not even remember the majority of her trip home. Ms. Peters called Dr. Valdez's office the following day to ask about the results of her biopsy, and after he did not return her phone calls, she asked her son to drive her to his office to get the results. When Ms. Peters arrived, she removed her winter gloves. Now this was in the beginning of May. She removed her gloves in order to show Dr. Valdez how cold and how blue her hands were. She also showed him her blue lips and her discolored face. He told her that he did not get enough samples, so he could not tell Ms. Peters if she had cancer or not. But again, Dr. Valdez instructed Ms. Peters to return home and drink orange juice, and he told her that she would be fine in 3 weeks. Ms. Peters did as Dr. Valdez instructed, believing that if she followed the instructions of the specialized physician, she believed that she would be okay. After 3 very difficult weeks, Ms. Peters was not okay, and she contacted her primary care doctor's office, and they instructed her to go to the emergency room, which she immediately did. Upon arrival, they discovered that she had a condition and was administered 2 units of blood over her 4-day stay in the emergency room and hospital. Now, prior to the incident, Ms. Peters rarely visited the doctor, usually once a year for a routine checkup and for pregnancy-related visits only. And prior to the procedure, the only ailment she was diagnosed with was menstrual cycle-related anemia. From the date of the procedure, Ms. Peters has had numerous appointments with many doctors in various specialties, sometimes as many as 4 per week. She has suffered from damage in the heart, lungs, brain, thymus, pancreas, and both eyes, which has resulted in her being diagnosed with lung nodules, asthma, glaucoma, insulin-dependent diabetes, lupus, cognitive memory impairment, and clinical depression. On May 13, 2014, the jury found Dr. Valdez not guilty. And on May 1st, after Dr. Valdez sent her home and said she'd be fine, the lawyer asked her why she did not find another hospital to go to. Since when is it the responsibility of the patient to provide their own medical care when they are in critical condition? Ms. Peters is an African-American Muslim female represented by an African-American Muslim male lawyer. She would hate to assume that racism and prejudice played a role in the outcome of the case. But when only the non-white jury members had things happen to them to delay the trial, it is difficult to expect that the evidence was viewed from an objective position and that the final verdict was just. Ms. Peters' life has changed for the worse in so many ways since having this simple procedure. People entrust their lives in physicians' hands, and as such, it should be ensured that they are receiving the best possible care. Ms. Peters was a healthy 45-year-old woman when she walked into Dr. Carlos Valdez's office. She did not receive the proper care that she should have been provided, and she only wants justice for what she has lost, which is her health and her quality of life. She has been fighting for many years and will continue to fight, and she is also planning to appeal this case. Actual evidence can be provided for those who want to see it. For more information on this story, contact Judy Peters herself at judypeters285@yahoo.com, or please call the number at the bottom of the screen. This has been another Video News special announcement presented by Angie BEE Presents. My name is Angie BEE, and I was proud to bring you this story today.